We've talked about a few. The one that a few years back people were claiming could reduce SHBG was stinging nettle.
Yeah.
Stinging nettle. Well, urinating seems to be coming up multiple times on this podcast for whatever reason. Stinging nettle extract. I took the most pronounced effect of that was you could basically urinate over a car when taking SHBG. What the underlying mechanism of that was, I do not know. I took it for a short while. It didn't drop my SHBG very much, but it did drop my DHT sufficiently so that I stopped taking it. I do not like anything that impedes DHT. I don't care if my hairline retreats. I don't care about any of that. DHT to me is something to be coveted and held on to because you feel so much better when your DHT is in the appropriate range. And I love your thoughts on that.
Yeah, again, it really depends on the guy, and it depends on what risk you're trying to manage, right? So prostate size starts to become one of the issues with DHT.
Luckily, my prostate-specific antigen is low, and DHT, the things that I know can reduce it are things like finasteride, Propecia, things like
Testosterone,
things that people take to try and avoid hair loss can dramatically reduce DHT and lead to all sorts of terrible sexual side effects, mood-based side effects, et cetera. But yeah, so I'm not aware of anything that can be taken in supplement form that can really profoundly drop SHBG.
We don't spend much attention on it anymore. Basically, I used to have a much more complicated differential diagnosis 8 years ago. Like I would drive patients nuts with the whiteboard diagrams I would draw for them. And in the end, I think they were just like, dude, just what do I need to take? Today, we take a much more simple approach. So the first question is, should you have your free testosterone being higher? That's the metric I care about. Is free testosterone is the first most important. The second most important is estradiol.
And sorry to interrupt you. You said if you look at your total testosterone, you want the free T to be about 2% of your total.
Well, it should be, right? Now, I might not change that anymore. So in other words, if a guy's at 1%, then I know I have to really boost his total testosterone. If he's only going to get 1 to 1.5% of it converted to free, I need to boost him. And that's why I don't care if he's outside the range. Like I'll have a guy who's free T. I might have to get a guy's total T up to 1,500 to get his free T to 18.
I see. So free T is the target. I like this approach.
Free T is what we treat.
And do you still use Anabolics, oxandrolone, to try and lower SHBG?
I don't.
Because it's too potent?
No, because it's just too complicated for patients. It's a drug that can't be taken orally, so you have to take it under the tongue.
Like a Troche or something.
Right.
Yeah.